Filipinos love bonding with friends and drinking all night long. Yan. But this soon takes its toll. There's already a rising number of deaths due to liver cirrhosis. Let's find out more about this and how it can be prevented. We have in the studio Dr. Maria Vanessa de Villa. She's the head of the Center for Liver Disease Management and Transplantation at the Medical City. Good morning, ma'am. Thank you very much for joining us here in the studio.
Thank you for inviting me.
Okay, what is cirrhosis?
Okay, cirrhosis is a scarring of the liver, basically. Usually there is some insult that causes injury to the liver, be it virus, viral hepatitis, alcohol, maybe fatty liver, some medicines. So this insult produces a progressive injury to the liver, leads to what we call fibrosis or scarring, and the extreme degree of this is cirrhosis.
What's there are stages? You're saying there's fibrosis first and then cirrhosis.
Yes.
Tell me the difference between fibrosis and cirrhosis.
Okay, fibrosis is scarring, basically scarring of the liver. You know, when you get a wound, you develop a scar, right? So the same thing happens in the liver, no? Because of some inflammation due to some cause.
When it expands more than its capacity.
Yeah, not really. Actually, the liver shrinks when it becomes fibrotic.
Oh,
it forms fibrous bands in its effort to solve the inflammation or to fight the inflammation. In the meantime, it tries to regenerate because the liver regenerates.
Right.
So a combination of the scarring, the fibrosis, plus some normal liver tissue left and formation of nodules, regenerative nodules, result in cirrhosis.
So tell me if I get this right. The scarring is mostly caused by the liver being overworked to regenerate? Is that?
Not really. The scarring is a reaction to the attack by some injurious element like virus, the hepatitis B virus.
Right.
For example, that is the most common cause of liver disease in the Philippines.
Right. We have the actually scary numbers here. The liver disease is a large and growing burden in the Philippines. There are an estimated 5,000 deaths from liver cirrhosis per year.
Correct.
16% nationwide prevalence rate of hepatitis B, the most common cause of liver cirrhosis. How does hepatitis B lead to cirrhosis? What does the virus do to the liver?
Okay, so the virus attacks the liver. It stays inside the cell, actually, but it produces and it incites an inflammatory reaction, such that the liver tries to overcome it by scarring. That is, in effect, it becomes fibrotic. And then the inflammation goes on because usually the hepatitis virus stays there for years and causes some kind of silent, progressive, slow injury to the liver.
Right. Okay. Hepatitis B is just one of the causes. There are other causes for you to have cirrhosis on your liver. What are the others?
The others are hepatitis C, although it is not as common in the Philippines as in the West.
Okay.
Alcohol. And fatty liver, fat has been shown to also lead to cirrhosis.
Is it just overconsumption? I mean, nakikita naman natin mga advice, drink moderately, not too much of fats, but even if you take these in moderation, could it still affect your liver, or is it just the overconsumption of alcohol and fatty
Usually
food?
It's overconsumption because that's the injury. That's what produces the injury to the liver. When it comes to fat, fat alone is fine, but when you have fat plus inflammation, what we call non-alcoholic steatohepatitis, very technical, but that's fatty liver with inflammation, that is what is dangerous because sometimes it's present also in people who are not fat. So somehow.
So it doesn't necessarily mean na hindi kayo mataba, hindi na kayo pwede magkaroon ng
correct.
fatty liver.
Yes, you don't have to be fat to have fatty liver.
What causes?
Most fat people, almost all fat people, have fatty liver.
Okay, but what causes the inflammation?
It's not very clear, but it has something to do with the metabolism of the fat inside the liver. So it produces some kind of inflammation. So in a way, it's also, the liver is sort of attacked by the fat, and in its effort to restore normalcy, it scars, no? It tends to develop fibrosis as well.
How does a person know if he has cirrhosis?
Cirrhosis. Yeah, good question, and difficult because many times people do not have symptoms. They don't feel
Scary.
anything. Yeah, right. They are well, and they may present initially with non-specific symptoms like weakness, easily gets tired, weight loss perhaps.
And that can be attributed to a lot of things. Some people might say it's just
Yes,
stress,
correct.
or some other, maybe the flu.
That's
But
right.
how would that person know if it's connected to the liver?
Well, they will have to seek consult and then they will be guided accordingly. No? Some of these people, in fact, present with the complications already, the overt complications of cirrhosis like bleeding, they vomit blood or they pass stools with blood, or they say, lumalaki daw ang tiyan ko, abdominal enlargement, but that's because of accumulation of fluid inside the body, inside the abdomen. And these are all complications of cirrhosis.
And for those cases, it may be too late for them already?
Sometimes, but others we can still do something even if they already have these complications of what we call portal hypertension because of the cirrhosis.
Now, how do doctors know if you have cirrhosis or not?
Well, based on the history, the symptoms, and the lab tests that we request, and the physical findings. Sometimes there are telltale signs of cirrhosis that we can see in the body, in the physique of the person, and then we
Aside
interview
from
them.
the expansion of the abdomen, what else?
Yes, sometimes they have what we call palmar erythema. The palms become red in color. Or they have...
Titignan tuloy.
Yours
Di
look
pa
all
naman.
right.
Okay pa.
Yeah, or they have what we call telangiectasias on the chest or the back or the arms. We call them
is that?
spider angiomata. They are visible vascular formations, spider-like. Parang there's a spoke and then tiny red lines from it.
Is it like parang pantal siya, or is it just a mark?
Sort of. It's a redness of the skin. Many times they don't even know what that is, or they don't notice.
Yeah, they may think it's just
They
skin
were
irritation.
bitten by a mosquito or
Yeah.
something. Yes.
Okay, if you were told that you have cirrhosis, what can be done? Are there medicines they can take? Are there definitely they have to make some changes, but what can they do? Can it be reversed?
Yes. The first thing we find out, of course, is what is the cause of the cirrhosis.
Okay.
Because that's where you attack and that's how you help them. If it is due to viral hepatitis, we usually get their serologies. We get their viral serology, so we're able to rule out or determine if they have hepatitis or not, and then viral hepatitis or not, and then we go from there. As I said, there is really no cure for cirrhosis yet, but there are some medicines.
No cure for cirrhosis.
No.
Oh, we have to make that clear.
Yes, yeah. So if they have hepatitis, there are some medicines that may help. If what they have is hepatitis B, some medications.
Okay.
Now, if the cause is alcohol, of course, we advise these patients to stop drinking. If the cause usually is not known and on history it may be related to fatty liver, we advise them a change in lifestyle, diet and exercise, change in eating habits, these things.
Smoking, kasama po ba dun ng smoking?
Medyo kasama rin ang smoking. Diabetes is also linked to cirrhosis now, so diabetics should also be on the watch out.
Okay,
so we've basically determined the cause and advise them again along those lines.
So again, you're saying na hindi na marireverse yun. But in the
Yes.
extreme case that your liver is damaged already, what can be done to help you out? Wow.
Okay. Usually if it's alcohol and they do not yet reach this, you might say, the end stage of cirrhosis, and they stop drinking, somehow the damage can be reversed. Kung nandun pa lang
there's
siya sa beginning scarring. But then, as I said, if it's the virus and it's not controlled, or it's fatty liver that you cannot easily solve, then it is progressive, it slowly progresses, and when they reach the end stage, they develop end-stage liver disease with all the complications of portal hypertension due to the cirrhosis. They may eventually need a liver transplantation.
Yun ang medyo
You know, change the part because nothing else can be done with it. No? So you need liver replacement.
Okay. For those people who may think that there's something wrong with their liver already, what can you advise? Kasi sinasabi niyo po kanina, medyo minsan you can't really relate what you're feeling to your liver.
Yes.
But
you don't
if
notice,
you,
no?
how would you know? How would that person know if he has to have his liver checked already?
Okay, so we have to know the risk factors of that particular person. Usually, they may or may not know they have hepatitis. So if there is somebody in the family who has, then they should be checked,
Oh, that history,
definitely.
yeah.
So if somebody in the family has liver cancer, they should also be checked. Then of course, if they have diabetes or if they know from ultrasound that they have fatty liver, then they should be watched.
For people, some people have their annual checkups. Would this be detected during those annual checkups? Some sort of blood test? Do they have to take a specific blood test to find out if there's something wrong with their liver?
Correct. Sometimes it's picked up during those annual checkups, but sometimes not, unless they are already in the stage when they have symptoms. No, as I said, like weight loss, maybe abdominal enlargement, or even vomiting blood. So when they have those symptoms, it's easy. But when they do not, usually the routine blood tests do not pick this up. No? So I guess being aware and conscious about one's health in general helps. So it will be good to have oneself tested for hepatitis B because it's prevalent in the country. You know, we have a 16% prevalence rate, very common. So it's good to know one's hepatitis B status, then go from there.
Okay, Dr. Maria Vanessa De Villa, the head of the Center for Liver Disease Management and Transplantation at the Medical City. Thank you very much for joining us here on the show.
Thank you very much, too.
Thank you, ma'am.
Welcome.